In today's Focus on Your Health, we are tackling macular degeneration, which affects many Tampa Bay residents. Dr. El Jabali of Newsom Eye are here to discuss technology and treatment options that exist for this disease. Good morning. Welcome back.
Thank you. Thank you.
We love that your team is all about education and making sure that people know what, certainly when it comes to vision and your eye care, what things are, why it's important to really pay attention to this.
Definitely.
So let's talk about macular degeneration. How do you best describe what it is?
So macular degeneration is an aging disease. It really affects the central vision of the retina, which is really in the back of the eye. And it's one of the leading causes of blindness in people over the age of 65.
Wow. So is that kind of at 65? Is that when you start to notice it?
It's a rough estimate when things get getting worse, maybe. But if people have a family history of it, it could start earlier. So it really depends on the individual, but roughly it's an aging disease.
Okay. So how do we know if this is starting to happen? When you talk about vision issues, what is it that people are seeing or that they may notice?
So people usually notice a central dimming or a dark spot in their vision in the center.
Right in the center, when they're looking at something, whether it's near or far?
Things would be a little blurry, whether it's near or far.
Okay. Does it generally kind of happen over time too? I mean, can people go a little while not knowing that this is going on?
Very correct. It could actually gradually worsen. So the earlier you catch it, the better.
Okay, so if we are seeing our eye doctor, as we should regularly, I'm assuming you're going to say that, would you be able to pick this up as well?
You have to have a dilated retinal exam.
Okay.
That's when you'll be able to pick it up.
All right, so let's talk about treatments and what happens if this is starting to happen. What are you able to do about it?
So we have available treatments. Number one, you have to eat healthy, your green vegetables, fish oil, sunglasses while you're out.
So this is somewhat preventative?
Correct.
Oh, good to know.
It helps slow it down. Wearing your sunglasses while you're out in the sun, eating healthy, having a healthy diet, vitamins for the eyes, and there's also medicine available for treatment.
Okay, and then so because anybody, okay with this treatment? How do you find out if something would be, a good option for them?
So it depends. There's really two kinds of macular degeneration. There's a dry kind and there's a wet kind. The wet kind really needs the medication. The dry kind, it's more of eating a healthy diet.
Oh, really? Can you go ahead and see results if you change diet? And I mean,
It slows down the progression of it. Okay. So yes.
Can you ever stop it completely?
Unfortunately, no. There's not a cure for it at this point.
Do you think there will be eventually? I mean, is that the goal?
Oh, yeah. There's a lot of research going on, so hopefully at one point we'll get something to fix it even better.
Okay. Well, what's your take home? If people are watching this morning, again, maybe if you know of a loved one of yours, a grandparent or something who has had this, or a parent, do you need to start watching this early?
So I do have grandparents who have this, and yes, the earlier you do catch it, the better.
Okay.
Then have regular exams, regular dilated exams. Make sure this is not worsening. Make sure we could tailor the treatment depending on the severity of the disease.
Okay. I mean, can people as young as in their 40s start noticing things? I mean, is it really generally?
Usually not. Usually later on.
Okay. Well, if people want to find out more, maybe they have more questions that they would like answered, and certainly this is just one of the things that you guys help treat and provide options for. What would you have them do? What's kind of the best way to come in and see you guys? So
they could call our office. We have a good team that's always available to screen.
And a couple different locations here in the Bay Area.
Different locations in the Bay Area, and we're happy to see them and evaluate if they do have it and how severe it is.
Okay, good. Well, Doctor, thank you so much for joining us this morning. We appreciate it, and again, we love that you guys are so passionate about education.
Thank you for having me.
All right, and again, we'll make sure and put that info on our website as well.